Hi everyone, my name is Allie Burton and I decided to do my topic on fetal reduction. So just as a warning, this topic might not be for those who are faint of heart or are uncomfortable behind the ideas of reduction or abortion. So if you feel uncomfortable, please feel free to skip over parts of this presentation. So I'd just like to start off by talking about what exactly is fetal reduction. So in essence, it is when a mother becomes pregnant with two or more children and something might occur that's undesirable to either the mom or the baby. Maybe the mom doesn't have the physical capacity to give birth to multiple babies, or the baby might have congenital abnormalities that don't allow it to have a high quality of life. So in saying this, it started out as a way of managing pregnancies in which carrying multiple embryos is high risk to either one of the fetuses or the mother. And this actually often occurs with moms who obtain fertility treatments and they end up getting too pregnant, and so maybe multiple eggs of hers gets fertilized, and there are complications that might occur with it to an extent where maybe one or more of the fetuses is reduced based on however many babies were made. So just touching basis on why this is an ethical issue exactly is that this procedure does involve the demise of a fetus. And I feel like in our world, abortion is generally highly frowned upon. So this does bring into question, well, what are some of the reasons why a mom may decide for fetal reduction, which is something I'll talk about later. But yeah, this is an ethical dilemma because nobody likes the idea of seizing life. And in society, I feel like we have this intrinsic value of human life, and to end it is shattering to some people because it also can go against religious beliefs. But I was doing some reading, and a lot of the sources say that the ideology of life and death has shifted more toward having a higher quality of life for the mom or baby, as opposed to people fixating on this idea of death. So this picture might be sensitive to some, just a little warning, but I do want to show you what the procedure kind of entails. So just kind of going over it briefly. As you can see, there are two little dark circular areas, which are the fetuses, and a needle is inserted into the fluid-filled pouches and potassium chloride is injected. But another methodology would be to utilize electrical currents. That is something the physicians might use. And this typically occurs around 12 weeks of pregnancy or somewhere in the first trimester. So some pros to this would be that, for one, it reduces the risk of miscarriage, which is often associated with having twins, triplets, etc. And it also reduces the risk of premature labor. So this can bring about complications for the baby because if they're born premature, their lungs and their heart and other anatomical features may be underdeveloped. And also health issues such as cerebral palsy and other intellectual disabilities might be evident in preemie. And one last pro is that it reduces the mother's risk of preeclampsia, anemia, placental abruption, gestational diabetes, and hyperemesis gravidarum. So lastly, just kind of talking over some of the cons to this procedure is that while doing it, it can also lead to the miscarriage of the other fetuses. And based on the studies that I found, 4% of the triplet to twin procedures and 7% of the quadruplet to twin procedures can result in miscarriage, or did result in miscarriage. And it was also found in another study that I found pretty interesting is that the likelihood of taking home a baby is higher after the reduction than remaining with just having the twins themselves. And another con is, the emotional risks that come with it. The mom might feel guilty, may experience grief and depression, so those are also some considerations to take in. And my last con is infection, and this is based on how the procedure is done, because it could be done through the belly or the uterus. So either one of those can become infected. However, based on the studies that I researched, it was kind of a rare finding. So lastly, here are my references, and I just wanted to thank you all for watching.